My name is Lisa Weston. I'm a practicing midwife. I'm one of the founding partners of Sage Femme Rouge Valley Midwives. I've been practicing for 7 years. We don't classically advertise. The reason being is that currently we don't have enough midwives to provide care for all of the women who want care. Each year, about 40% of the women who call in for care can't get it because we don't have enough midwives. All of the growth of midwifery, we started in 1994 with about 80 midwives, and this year we're around 500. All of them are looking after an additional 30 to 40 women or more each year. All of that growth has happened through word of mouth. We want to advertise because midwifery is so great for women and families, and that women who find out about it want it, but we also feel that advertising and inducing more women to call in for midwifery care and not being able to provide that care is also not such a great thing. I think no matter how seriously you take your student days, the day that you go out first on your own without a preceptor with you or standing behind you, the day you go out on your own as a midwife to provide care is sobering. To know that you are responsible for the care of that woman. I remember after my first birth and driving home and planning as a new registrant and planning the postpartum visits that we do at home and thinking, wow, there's a woman and her baby in the community that are relying on me to make sure that they're well and healthy. And that's a bit daunting for some midwives. I think a lot of midwives, and you have to really get used to that responsibility and not be afraid of it. You have to take the mentoring and the support that a practice should provide you during that first year to really learn how to provide good clinical care to women and how to find out what you don't know, deal with situations as they come up, learn and enjoy what you're doing. You have to learn how to live the lifestyle of being on call. So when we're interviewing new registrants, we want to find out, we know coming out of the midwifery program that a basic level of clinical skill is there. That's presumed because you've passed the program. It's a very rigorous program. What's important to a lot of practices, and especially to us, is that the personalities fit. We're working very closely together in sometimes very intense situations. We have to feel like we can work together well, we can communicate well. It's a tough job. So in our practice, we like somebody who has a sense of humor, who's pretty easygoing. When everybody is stressed, you have to have the skills to deal with that and not make it any worse. And so laughter, like I said, a good sense of humor, trying to be calm and collected. You have to be quick mentally. You have to be able to think on your feet. You have to be able to change plans as required. It's a lot of hard work. You can't just let things slide. You have to be able to step up and be responsible for the care you're providing. And midwifery is really very self-reflective. So medicine changes, research changes. You have to be able to look at what you're doing on a day-to-day basis, how it's seen by that woman you're providing care to, and how you can always improve that care. So having a practice group of at least 3 to 6 or more midwives enables you to provide that kind of coverage and still have some off-call time. So currently right now we get to have 2 months off a year. And when we have months on call in our practice, you get 1, sometimes 2 weekends, 4-day weekends off call a month. So when you're off call, you're off call. You turn your pager off, you don't go to birth. The other midwives cover your clients during that time. And then when they're off, you help to cover their clients. Other practices do things where they do more of a rotation. So you may be off call and doing clinic 1 week and then on call the next week. So sometimes practices will organize themselves in pods of 3 or 4 midwives and do more of a rotating schedule. Every practice does things a little bit differently, and the goal is to try to help midwives have some off-call time so they can have quality of life, spend it with their family and friends, and not be working all the time. It is stressful to be on call, and you have to get used to that. It's not for everybody, but going into an office 9 to 5 and doing the same thing every day is not for everybody either. So midwifery is exciting. It's not like any other job. You get to do so many different things in a day. And because you're your own boss, basically you're working with a group of other midwives, but you get to set your own schedule. You get to, there's a lot of driving involved, but so you get your own alone time. You get to teach. There's so many offshoots of midwifery that can keep your interest besides just the wonderful part of looking after women and babies.